Does the word dentist scare you? Do you have a real fear of your annual visit? Should be semi-annual, by the way. To have your teeth checked, or even worse, do you not make the appointment because of your fear? Well, this morning we're putting those fears to rest. Dr. Richard Boatman and Dr. Jordan Spencer from Troy Family Dental. Welcome back to Great Day St. Louis, gentlemen. Always a pleasure to have you.
Great to be here.
Now, back when I was a younger man and you were middle-aged, you had you had to have a pretty major procedure in order to be sedated. This was something that you were going to have to go in and get surgery or something else, because I can remember the dentist yanking teeth with me, you know. But that has changed along with technology, like the mini dental implants that you talk about so often.
Yes.
So let's talk about sedation and how things have changed.
Well, it's changed tremendously. I mean, it's estimated that 40 million people a year avoid the dentist for a lot of good reasons, really to the detriment of their oral health and their overall health. And they do for a lot of reasons. A lot of them have had bad experiences. They've been hurt. They're needle phobic. They have bad gag reflexes, and they're claustrophobic. They just don't want anybody in their mouths, and it really their confidence suffers, and their overall health suffers also.
And that really folds back on itself, because the less we take care of our teeth, the more of these kinds of procedures we're going to end up needing, and it really snowballs before too much longer.
Yes, absolutely. So we have a lot of great different sedation techniques Dr. Spencer will talk about.
Yeah, all right. And we found a way to help these people because we had to. So there's really different levels of sedation that we can do. The lightest is just giving a simple Valium pill and putting them on nitrous oxide. Takes the edge off. The next is they could come in and we could actually give them pills in the office, and then you don't have to get an IV. And the last is actually IV sedation, and we have a nurse anesthetist come in and watch over the patient, make sure that their safety while we focus on the dentistry.
That, you know, the nitrous is good. With that, I always used to say, it still hurts, but you just don't care. You know, it's kind of one of those. But with the full-on sedation now, we're talking about no pain.
Absolutely. The patient is resting comfortably. A lot of them are actually snoring. It's actually extremely safe. Like Dr. Spencer said, we use the CRNA.
What, the snoring or the procedure?
Well, the snoring, yeah. If they're snoring, you know they're breathing. But
right, that's a good point.
But yes, we use the CRNA that has 40 years of experience. We follow all state and American Dental Association protocols. We use an EKG machine to monitor their heart. We monitor their blood pressure, oxygen saturation. We even use capnography to make sure that they're exchanging oxygen and carbon dioxide adequately.
And there's a very important series of questions and preparations even before you get to the office that have to take place before you even know if you're a candidate for this kind of sedation, because you have to take this kind of thing seriously. But another beauty in my estimation of this is that if you have a lot of work that needs to get done, and you would normally say, all right, that's enough, you know, the one root canal is about, you know, we'll come back, we'll do this the other time. You can get everything accomplished
Absolutely.
at once.
Everything completely finished. Patient is breathing on their own. They're actually laying back taking a nap. They wake up and they have little or no memory of the procedure at all.
All right. Sounds like a great idea to me. If you want to make an appointment with Dr. Spencer or Dr. Boatman at Troy Family Dental, call the number on your screen, 618-477-8421, and ask for the happy hour special. It's going to be beyond pleasant, I'm telling you. Listen, you can also find them on the web. They're good people over there, and it's well worth finding this shop, their practice, at troyfamilydental.com.
20 minutes from any bridge.
That's right, and addressing a very serious need that a lot of people really